Sue Livers asked me if I would be one of the presenters for Dr. Hare's induction into the Wall of Honor, and she almost seemed apologetic at the time when she asked me. And she may have asked me because I was one of the few remaining physicians that actually had worked and could remember having practiced with Dr. Hare, which is hard to believe. But I think I have been fortunate to be involved previously in several inductions, and I've always considered it a privilege. Most everybody that's been inducted is a little bit older than I am, and I've always felt that the physicians that went before me were what I would call real physicians. Diagnosis back then weighed very heavily on your diagnostic and acumen skills, and less on testing. Now that's not to say that, and that's also one of the reasons why the office visits were less than $15 when I got here. Nowadays, diagnostic skills frequently include the ability to read reports generated by the various testing modalities that are available to us, all which are easily accessed, sometimes off the computer, but not always. Now don't get me wrong, that doesn't mean that that takes knowledge out of it. You still have to be a history taker, you have to listen, you have to take those skills, head down the right path, but the newer technology, I think, makes certainty about diagnosis a lot easier than what it was before. Dr. Hare's a Duke man, if I'm not mistaken. That caught my eye when I was brought to Madison. Duke to me is to medicine what Harvard is to the Ivy League, New England Patriots are to football, or the Yankees are to baseball. When I first met him, I expected an aloof, arrogant individual that would be hard to approach, but I found that would be farther from the truth. He, to me, is about as down-to-earth as one could get, very easy to talk to, very soft-spoken. Genteel is often the word that is used in reference to Dr. Hare. And when I looked it up in the Webster's Unabridged Dictionary, which happened to be over 2,000 pages, small print, large pages, it only said a French word for gentle and noble. That tends to me to summarize Dr. Hare about as succinctly as it can be said. He is about as unassuming and unpretentious as anyone I know, which is sometimes a bit rare in the medical profession. I was talking to someone in the hospital recently about Dr. Hare. I mentioned I was going to talk and present today, and they said he was so kind and gentle that when he ever did decide to discharge a patient from his practice, the patient didn't even know it happened and often thanked him for it. I've been blessed to know Dr. Hare for close to 35 years, and I've known him not only as a colleague and as mentor, but I've been able to know him as a dear friend. We had him out. We had a Madison clinic